All right, so positional release for the hamstring. A lot of times if somebody pulls a hamstring, it's because it's overstretched. And you have a neuroreceptor called the muscle spindle, which when you overstretch a muscle, it causes the muscle to contract to protect against overstretching so you don't tear a muscle. A lot of times after you do that, when someone pulls a muscle, the muscle spindle is not letting go, it's not relaxing, so you have a chronically tight muscle. In this case, we're just going to demonstrate on the hamstring. There's several different hamstring muscles. We'll treat them basically all the same. So what we want to do to shut off the muscle spindle is take away any thought that there's danger of overstretching. So we do that by shortening the muscle to its shortest position. We have attachments here on the lateral head of the fibula and also on the tibia over here, and then the ischial tuberosity of the pelvis here. So the movements that the hamstring does are hip extension and knee flexion. So we need to do both of those to shorten the muscle. We need to bring the attachments as close together as possible. So we need to fully flex the knee and also fully extend the hip. So we're going to lift this up, and we'll tuck a towel there just to keep this in full extension at the hip. And then I'm going to manually flex the knee. And so we want whoever you're working on, we would like them to relax completely so their hamstring is soft to the touch. And if they have a sore spot from if they pull a hamstring, then there's typically a spot where it's really kind of painful to the touch. It should loosen up and not be as painful when you push on it when the muscle's in a completely relaxed position. If you need to, if we extend here, that actually helps quite a bit. So his was still kind of stiff. We lifted the knee more, which extends the hip more, and that's the position we'll hold it in. So once we're in that position where there's no thought of danger of overstretching, the muscle spindle is completely off right here because the muscle's not in stretch at all. And so we're just going to hold that position for a minute and a half to let the muscle spindle accept that it's not in danger and relax and restore the muscle back to normal. So you would just hold this in one position for at least a minute and a half. For leg muscles, I typically go 2 minutes. But again, we just want the attachments to be as close together as possible, which means for the hamstring, flexing the knee, extending the hip, and making sure the person that you're stretching is completely relaxed and not engaging the hamstring. Hold it there for 1.5 to 2 minutes, and that should take care of it. After that, once you return it to normal, it should alleviate the pain significantly, and then you can start to slowly incorporate gentle stretching and take it from there. That is positional release. So in the case that I don't have a partner to help me with the positional release, I'm going to use a jiu-jitsu belt. I'm going to make a loop around my foot, and then I will lay on the table on my stomach. Again, I'm going to prop up my knee here with a rolled towel. Or you can also use something bigger. If your hip flexors are pretty flexible, then something to elevate it higher is fine too. The main thing is just that I want my hip extended, hip flexors flat on the table without engaging my hamstrings. And so I'm going to just hang out here, hold the rope here, go ahead and relax. And hang out for 90 seconds to 2 minutes. 2 minutes is ideal. And then when you're done with that, you should have significant relief.